And on day one of the shutdown in Quebec, Premier François Legault says we are facing the greatest battle of our lifetime. Good evening, I'm Dwight Drummond. I want to welcome viewers from around Ontario and Quebec and across Canada on CBC News Network. Over the next 30 minutes, we'll take you live to Ottawa, Montreal, and Windsor for the latest local news headlines in those cities and here in Toronto. At 6:30 Eastern, Vashi Kapelis will be back with Power and Politics. We begin with economic help for people across the country who have lost income due to COVID-19.
Last week, almost 1 million people applied for employment insurance. The hard truth is that people are out of work because of this crisis and worried about what comes next. So I want you to know that we'll be there to help you.
That help will come in the form of a new benefit called the CERB, the Canada Emergency Response Benefit. It will provide $2,000 a month for 4 months. Here is who will be eligible for it. Anyone who has lost their job, anyone sick with COVID-19 or taking care of someone who is ill, anyone quarantined, working parents who are staying home without pay to care for someone, including children, anyone who still has a job but isn't being paid because of disruption to their work, and finally, anyone who is self-employed and not eligible for EI. As for how you will apply, an online portal is expected to launch in early April, and within 10 days of signing up, you should receive your check. Federal officials also announcing that as of midnight tonight, all travelers returning to Canada must now go into a 2-week quarantine. It is no longer just a request. It will be mandatory. Nick Bover has been talking to travelers who are now facing fines if they don't follow the rules.
After close to a year RVing across the continent, Sharon Mead and her husband Jerry are coming home to Toronto. It won't be the welcome they were expecting.
The mandatory isolation and works not being open is actually terrifying. It's terrifying. I have a refrigerator that is only, I think, 8 cubic feet. So it is not going to hold 2 weeks worth of food.
Starting at midnight, incoming travelers at airports and land crossings will face a mandatory 14-day self-isolation order. Ottawa revealed the new rule today by rule of the Rarely Used Quarantine Act.
People have been making real personal sacrifices to self-isolate and to practice physical distancing. At the same time, I think all of us are going to be and feel safer with mandatory quarantine for anyone entering Canada.
And the rules are even more strict for people who appear sick.
Individuals who exhibit symptoms upon arrival in Canada are forbidden also from using public transit to travel to their places of self-isolation.
The government clarified that point later and said the transit ban applies to all returning travelers. People showing symptoms will also be barred from staying near vulnerable residents. Ottawa says those who disobey the rules or break their isolation will face significant penalties, though it's not yet clear who will enforce them.
I think at this stage of the game, it's difficult to know how do you enforce, how do you know whether there's a violation or a recommendation that's not being followed.
Toronto's top doctor says she prefers education to enforcement, but didn't rule it out either.
And my request to our members of our community is to simply abide by the recommendations and not put us in a situation where we have to move to more serious measures.
The federal government will take down contact information from returning travelers, and they say random inspections will follow. Ottawa has also hinted at establishing a hotline where people could report violations. Nick Boisvert, CBC News, Toronto.
And Nick is reporting from home tonight. Let's bring you up to date now on the number of COVID cases in Ontario. Today, we saw the largest single-day increase in the number. The province has confirmed 100 new cases, bringing the total number to 688. There are now 13 virus-related deaths and 8 cases that are resolved. The number of cases under investigation in the province stands at 10,489. There have also been 24,458 people who have tested negative for the virus. Sadly, 3 of those 13 deaths happened in Toronto in the past 24 hours.
The first, an elderly man with pre-existing health conditions who was tested at North York General Hospital. And as well, 2 residents of Seven Oaks Long-Term Care Home.
There are now 319 cases of COVID-19 in Toronto. 22 of those people have been hospitalized. The city's chief medical officer says 16% of the cases are due to community transmission of the virus. The provincial government released its fiscal response to the pandemic today. The one-year plan is meant to lay out a spending roadmap to deal with COVID-19. The province is investing about $3.3 billion for healthcare, including expanding hospital capacity, testing, and improving service in long-term care homes. $2 billion of that funding is for COVID-19 response measures. Another $2 billion will support families and jobs through the pandemic. There will be $10 billion in tax deferrals for businesses. Now, for families, the province is giving a one-time payment of $200 per child and $250 for those with special needs. You can apply online for those as of April 6th. Student loan repayments are being suspended until the fall. The provincial government also proposing to double the amount low-income seniors can get on a guaranteed eligible income. We are also learning that the next year's deficit will be $20.5 billion, double of what this year's projection is. For a deeper dive into the province's plan and finances, let's head to our Queen's Park reporter, Mike Crawley now. And Mike, the budget that was put together weeks ago and was scheduled to be released today had to be thrown out.
Literally, Dwight, tossed in the shredder. And that's just a sign of how quickly things changed. And frankly, everything has changed. For instance, there's Premier Doug Ford, the guy who was elected on a promise to cut the size and cost of government, tabling a budget with a deficit of over $20 billion. I asked him in the news conference today whether he ever imagined that he would do such a thing.
These are unprecedented times. And I'll tell the people of Ontario, we will do whatever it takes. We will spend whatever it takes to make sure we protect the health and the economy of this province.
Now, spending whatever it takes, this is record spending for an Ontario government. Dwight?
Mike, when preparing a fiscal outlook like this, they also have to make forecasts about what's happening in the broader economy. So what do you make of what the government outlined today?
Yeah, so they have to forecast what happens in the economy so they can forecast what's going to happen with government revenues. And the forecast for the provincial GDP that the government is putting forward is that the economy will neither grow nor shrink in 2020, that basically it will stay stagnant. Now, that forecast they said they made just a week ago when they were putting together this budget document. Literally in the past 24, 48 hours, the big banks have lowered their economic projections for Ontario, ramping them down, suggesting the economy could shrink by as much as 5.5%. And if that happens, Dwight, the province is going to bring in a lot less revenue than it was predicted, and that $20 billion deficit could be even higher. Here's the finance minister.
This is something that's going to be very volatile for the period ahead. Obviously, the projections we made are ones that we think will stand up, but we are going to have to adjust them.
Even that optimistic projection would see Ontario bringing in almost $6 billion less revenue than they were expecting just a few short weeks ago.
Before I let you go, Mike, anything else in this document that jumps out at you?
Yeah, there's one figure that seems shocking almost. The revenue for Ontario Lottery and Gaming, which is usually projected to be over $2 billion, is literally slashed by 2/3. So they're projecting basically a $1.5 billion less revenue for Ontario Lottery and Gaming, and that's because of the closure of the casinos, as well as people out there buying less lottery tickets. One other point that I wanted to make is the increase in the education budget. It's about a 1.5% increase, and that's bound to get some reaction from the teachers' unions and others, because it's not an increase that would keep up with inflation and the growth in student enrollment. Dwight?
Mike Crowley reporting from Queen's Park tonight. Thank you, Mike. Let's head to Ottawa now for the latest developments from the National Capital Region. Omar Dabagi Pacheco is standing by live in the local newsroom there. Omar?
Thanks for that, Dwight. Yeah, I'm just outside of our studios here. Ottawa's mayor here declaring a state of emergency today, and that does two things. One, it allows the city to react quicker to the COVID-19 pandemic. It also gives them more power to buy things like equipment and supplies without having to go through the usual procurement process. And so what it does as well is to fast track things like if they need to buy personal protective equipment for staff, or if they need to buy food for shelters, hotel rooms for emergency workers, that will now be easier for them to do. And they're doing this because they say they have never seen an emergency situation like this before. And they're worried that the numbers are really going to skyrocket. Now, if you want a snapshot of our city, of what's happening here right now, you just have to look at the public transit. Usually there'd be tons of buses here at this time of day. There are none. The buses that do go by are almost completely empty. And that's because the Transit Authority says that ridership is down by about 90%. Now, to some degree, that's a good thing, because that means people are heeding the warnings, they're isolating at home, and so there's less need for those buses. They're going to take a lot of those off the road. And that is perhaps to do with why there are no new cases here in Ottawa today. But there is another issue, which is that there's a lot of testing going on, and now healthcare workers are starting to get sick. And to fix that problem, medical colleges across the country really have started to ease the requirements of graduation for medical professionals so that they can really fill those front lines before the system gets overwhelmed.
Terry's here to do that, and then
they're on the front lines and they're starting to get infected. Now, frontline healthcare workers and their colleges are preparing to ease the burden by fast-tracking students on the verge of graduation.
It's a little daunting to know that my responsibilities are going to be complete 180, going from sitting at home to going and working in the hospitals, being in direct contact with this virus that's kind of causing havoc all over the world.
The ICU is where Maria Obas was fulfilling the last of 336 required hours of hospital experience in her fourth year of study. Now she's being told those with more than 80% of their completed hours may be called on to the front lines.
A year ago, it was kind of, I was looking at getting excited to starting off and getting my feet wet. And now it's kind of, not only are we going to be doing that in a few short months, but it's going to be in the middle of a pandemic and kind of like an emergency situation.
She's not the only one. The Royal College of Physicians and Surgeons of Canada has postponed all spring exams, and with help from provincial authorities, it's providing provisional licensing so resident physicians can provide essential help.
We are in uncharted territory here, truly. And so in this pandemic, whereby it's really all hands on deck with these very talented and well-trained residents, they are the ones who will be taking care of patients.
When it comes to paramedics, there are fewer than 500 fully qualified paramedics ready to work in Ontario. So colleges are looking to graduate students who have completed 80% of their competencies.
I think now more than ever, I'm kind of starting to realize the level of responsibility that I'm about to have. So in a way, it's kind of like a bittersweet. It's what I wanted, but I didn't think it would come in this way.
And you know, I've heard another series of concerns from frontline workers, which is that people seem to be showing up at emergency rooms when they really shouldn't be. And now they're calling for some sort of triage to be set up outside of all hospitals so that virus patients can be isolated from other patients, and to ensure that the people that are in charge of keeping us safe can continue to do their jobs. Dwight, for now, it's back to you.
Omar Dabagli-Pacheco from the quiet streets of Ottawa tonight. Thank you, Omar. Toronto officials moving today to close city playgrounds. It is the latest step in the ongoing effort to keep people from gathering in groups. For some, unfortunately, the social distance message is still not getting through. Greg Ross explains.
It felt very much like spring around Toronto today, incentive for many to get out and enjoy it.
I don't think it's good to be cooped up inside all day.
But inside is where health officials and political leaders are telling people they need to be right now.
Because ignoring these rules puts every single one of us, yourself included, at risk.
Those warnings were not enough to keep people away from this skate park.
He's really active, so I gotta keep him. We just keep away from people as much as I can.
If you're a couple feet away from somebody, you're not spitting on them, so you're not gonna give them the virus or anything, right? So as long as you're keeping your distance, it's all good.
Toronto's mayor doesn't agree.
Effective today, all facilities within the city's more than 1,500 parks are closed.
Today, John Tory sent out this video, which included a long list of facilities people are no longer allowed to use.
Playgrounds, outdoor fitness equipment, sports courts, leash-free zones, picnic shelters, sports fields, skateboard parks, and other parks amenities.
Not good news for these basketball players who say they need the exercise.
I think you have to balance concern with other things, you know? It's not just about coronavirus, right? There's other things that, you have to take care of as a healthy individual.
For the time being, he'll have to take care of those things away from Toronto's parks. Greg Ross, CBC News, Toronto.
Let's head to Quebec now. Host of CBC Montreal News at 6, Deborah Arbeck, joins us live. Deborah, what is the latest there?
Dwight, thank you. Making a wartime reference, Premier François Legault says Quebecers are fighting the greatest battle of their lives.
Quebec is united as an army of 8.5 million people in the fight against the virus. Every action we take will bring us closer to victory. Our children and grandchildren will remember how we won this battle. So let's make them proud.
François Legault confirmed another surge in the number of cases today, more than 300. We now have a total of 1,339 cases. 3 more people have died for a total of 7. One of those deaths was in Montreal, the city's first. Now, the province says the higher numbers of cases are in the range of what they were expecting, that there is a reason to be encouraged. Nancy Wood has more on that from our newsroom for us now. And how are public health officials seeing these numbers, Nancy?
Well, Deborah, they say there's good news because we've had more than 26,600 negative results. And when you consider that Quebec really targeted testing to people who were at highest risk, it's encouraging that so many people do not have COVID-19 and the positive test results are not increasing daily in larger numbers.
We had times when we double every day the number of cases getting out. We have almost the same as yesterday. We'll see what is going to happen tomorrow.
In Quebec, we chose to test only people that have traveled plus have symptoms. In other provinces, we don't know if it is what they did.
Nancy, the federal government announced strict new quarantine rules today aimed at travelers and snowbirds, but Quebec is taking a little bit of a different tack.
Yeah, Premier Legault said he would prefer to take an educational approach rather than fines or imprisonment. He wants people to stay inside when they get home from traveling, and he says that means inside, not even a walk outside.
I ask our snowbirds that are coming back to isolate themselves. The snowbirds, they cannot go for a walk outside. Please stay inside for 14 days.
Public Health also said today if you see graphs that are scaring you or freaking you out, just relax a little bit. They said anyone with an Excel spreadsheet program can make a graph. They're going to be evaluating their own scientific charts a few days before April 13th to decide whether they'll lift this shutdown and start opening things up again or whether this continues for some time longer.
All right. Thanks so much, Nancy.
You're welcome.
Well, today was the first day of the government-ordered shutdown of the province. All but non-essential businesses are supposed to be closed. But as Simon Akonechny explains, not everyone's listening.
It's not your usual weekday on St. Catherine Street. The normally bustling retail heart of Montreal is mostly deserted. Stores are shuttered by order of the provincial government. Hamdi Abdallah worries about his sky-high rent. How do I pay my rent, he says. There's no money coming in. A lone island of shopping activity is this Best Buy. Customers are being allowed one at a time to come in and pick up their online orders.
My son wanted to Blu-ray DVD.
No, I'm not scared. I should be. No, I'm not. If we respect the rules, should be fine.
Today's the first day non-essential businesses in the province have to be closed by law. The Premier says employees who are being asked to come in anyway can tell the government.
We can impose fine, but we don't want at this point. But people that see that they work in a service that is not on the list, they can stay at home.
Over on Saint Laurent Boulevard, things are surprisingly bustling. Many restaurants are still offering takeout, which is allowed. So are trips to the grocery store and pharmacy. The pawn shop is also open. The owner says they provide a financial service for those who need quick cash. And if they were to close, clients couldn't get the things they pawned back. In a statement, the Premier's office says pawn shops aren't allowed to keep their physical spaces open to customers, and neither are electronics retailers like Best Buy because they aren't considered essential services, but that the stores can continue to operate online as long as they offer a delivery service to customers. Simon Akinishny, CBC News, Montreal.
And in a statement, Best Buy Canada says people are relying on technology to transition to working and studying from home. The company says it's waiting for clarification from the Quebec government. Police in Gatineau are confirming for the first time they've issued a fine to someone who refused to respect the ban on gatherings. Police responded to a noise complaint and found 2 of the 5 people inside didn't live there. The man was fined $1,000 after the people gathered in his home refused to comply. Homeless Montrealers with symptoms of the virus will be accompanied to testing centers and put up in a hotel while awaiting results. Beds will also be opened at Notre Dame Hospital for those who need to stay in hospital. Yesterday, a Montreal shelter sounded the alarm. One of its clients who has COVID-19 left a testing site and later showed up outside the shelter. The city had planned to use the old Royal Victoria Hospital to help the homeless self-isolate, but the city's director of public health admitted today the situation evolved faster than they thought.
We're going to look in the next few days how we can make sure that there are not so many concentration, and if the shelter stays open, how we can make sure that they have the equipment to protect themselves and the practices that will prevent cases or transmissions.
The Premier is asking landlords to go easy on tenants who may not be able to pay their rent April 1st. Some tenants groups are pushing for a strike on the payment of rents altogether. They're calling on the province to put in place measures to help. The number of cases in seniors' homes in Quebec is rising. In Montreal, 7 patients and 2 staff members at a long-term care hospital in the North End have tested positive. The number of cases at a seniors' home in Sherbrooke have more than doubled to 20. The province's biggest nurses union says staff at the long-term care centres are not being provided with the equipment that they need. And Dwight, that's what's happening right now in Quebec. I'll send it back over to you.
Deborah, thank you. The operator of a handful of hotels across southwestern Ontario is using his decline in business for the greater good, offering up rooms to healthcare workers and those battling COVID-19 on the front line. Windsor's Chris Ensing joins us with more on that now. Chris.
Yeah, it's sort of a bittersweet business story. The operator says that he just wants to help. The rooms are already empty. Business-wise, they've taken a pretty big hit. Rakesh Sharma says that he's had to lay off 230 people who usually work at his hotels. They usually employ about 300. Now, with the rooms mostly empty, he's offering them to the Ministry of Health. Here's where those are located exactly. He's got 1 hotel in Cambridge, 3 hotels in London, and another hotel that's here in Windsor. Now, we're focusing on the Windsor Hotel here because it's on that border city. This one is a Holiday Inn. All 5 are not under the same umbrella, but he is offering up entire floors to health units in the area. Because of his skeleton crew, he's not offering a full cleaning service. He wants to keep his employees healthy and the people who might be using it as well healthy and free of worries about COVID-19. He's still trying to work out possible compensation. He says he already knows that 2020 is going to be a huge hit financially. In our chat, he talks about how he's just trying to help.
We got call from the Ministry of Health and Paramedic Department that they want exclusive floor for their employees, and we are ready to offer them and work as a partner with them in this tough time for the entire nation, right?
Now, I asked the ministry if they've been able to do anything with this offer. I wasn't able to hear back before we got to air, but Sharma did say that his mind is with his employees during all of this as well, and assured me that if this is something that the Ministry of Health takes up, they'll be following the ministry guidelines and making sure that the cleaning practices are safe for the people who use the rooms and also the staff who are still on those skeleton crews at those 5 hotels. Now, as we talk about what's happening with COVID-19, there was a big jump in cases in southwestern Ontario Ontario, specifically when we look at Sarnia, Lambton. They had their first confirmed cases from the public health unit today. What we can tell you is that there were 5 confirmed cases. All 5 people are in their 60s. Now, when we talked to a spokesperson, they said that they did present at the emergency department in Sarnia, all 5 of them. And they're currently in hospital being treated. The tests took 24 hours because of the symptoms. They were so severe. We don't have an update on the condition there as of right now. Meanwhile, we look across at Detroit and we can see the numbers there are in the hundreds, about 700 before we went to air, of positive COVID-19 tests for people right across the river from us. And that's caused our medical officer of health here to worry about community transition. Here in Windsor, Essex, we had our 4th case confirmed. That was someone traveling from the U.S. into Canada, and another call for people to really take that self-isolation, which is now mandatory, very serious. We have all of these details on our website at cbc.ca/Windsor.
Thank you, Chris. And thank you for joining us. We are working hard to bring more local news back over the next week. And remember, for news anytime, just head to cbcnews.ca. Power and Politics with Vashi Kapelis is back after this break.